Welcome back to Ohio Means Business. Efforts to reform our nation's healthcare system could benefit from some best practices used by a business on a regular basis. Joining us with the bottom line, W.C. Benton, professor and healthcare management expert at Ohio State's Fisher College of Business. Mr. Benton, appreciate your time. Thank you.
Thanks for having me.
You actually teach a course on this. It starts this spring. Your course is focused on the business of healthcare, right?
Absolutely. We started last night. And the course looks at the complexity of the healthcare environment in America. And we also have to look at the complexity as it's related to the world healthcare environment.
I would imagine that your course is ever evolving, that it doesn't stay the same over the years.
That's exactly right. Last night we did an update on the Healthcare Reform Act, the ACA, and you know, it was just passed about a year ago. I think it was March 23rd, 2010, and it's changed tremendously since then. We did an update in August also at the Executive Center at Ohio State.
Big changes this year in the Healthcare Reform Act takes effect. Big changes in 2012 and 2014. This is all if the plan stays in place. What do businesses have to think about when dealing with this Healthcare Reform Act?
First of all, I should say that all businesses will be affected, both large and small. Large businesses will be affected in a bigger way. Because some of the small businesses are exempt from some of the provisions in the Act. However, all businesses have to use a sense of urgency when it comes to trying to figure out what's best for their particular industry and their business.
We discussed this a little bit earlier on the show. I'll ask you the same question. Could some businesses go under because of the new requirements placed on them?
Well, when you consider most businesses really believe that there was a need for some sort of reform in the first place. They were based in their belief on the fact that they wanted cost reduction and they wanted their employees to live a little healthier, and also they wanted to somehow reduce the total cost of doing business in terms of overhead. I don't think they really cared that much about the uninsured part of the bill, and that's usually the major focus of this particular bill. And also there's a technology part of it that's going to be significant too. So I think their goals were a little out of sync with what the bill was about. So they're expecting a significant cost increase.
I know you have 3 key words that you focus on in your class. I like them: adapt, improvise, and innovate. If a business does those 3 things, they're going to be okay, right?
I think business has to look at anything that becomes a constraint as an opportunity. And that's one way to do it. You have to adapt. You have to improvise, because within that bill and within that act, there might be a lot of things that you can do that make your business better, depending on the industry. Because it's a chance, you'll have a chance to reshape your deal with your employees. So you can disrupt the whole thing and you might end up with something better.
Healthcare is not your traditional industry at all.
No, no, it's complex. Healthcare is not an automobile factory. It's not a airplane factory. And it's not somewhere where you're producing steel. You're dealing with people.
W.C. Benton from Fisher Business College. We appreciate it.
Thank you.
Thank you, sir. Good information.